Hello everyone, coming at you for another journal video, number 58. Still at Children's, finished the week at Children's, seen some interesting cases, did a lot of ortho type stuff this week, broken arms, putting casts, putting slings, summertime, I think, seeing a lot of that. Getting recommendations from ortho, putting someone in a sling or slinging them a certain way, and all those kinds of things, and follow up. Some lacerations, still doing those. A lot of fevers. We're getting like native COVIDs, but different infections. Probably the most significant thing that's on my brain is like, oh, okay. And then besides that, clinic has been busy, so I'm like on this R2 schedule of like clinic 2 days a week and seeing patients, seeing walk-ins too. Been a lot of walk-ins, and it's been mostly good things. I had like a really solid like all-around day. I think Wednesday did like a carpal tunnel injection, had an OMM continuity visit, had prenatal visits, COVID swabbed a kid, like true family med, like all around. Telehealth, like hypertension, diabetes. Friday was good. Friday we had like code blue in the right in the morning. I responded with the attending. It was like someone was in respiratory distress, and they're coming through a certain area where we take a lot of our COVID or respiratory symptom patients and kind of isolate. And we got there, and then the patient collapsed, so we called code blue, and it was like we were able to get EMS involved, and the patient did okay transferring, but it was a very first thing in the morning Friday, high intensity like way to wake up and get into it, and it was a lot of learning. It was good. I was right in there. We couldn't really get a pulse, and then we ended up able to get a femoral pulse on my attending, and just kind of working through the ABCs, and we debriefed, and it was really good as a team, and trying to like what went well, what could have went better. But yeah, seeing a lot of like interesting like common like walk-in type stuff, like BPH, like allergies, swabbing some people, a little bit of injuries. It's kind of like an urgent care type thing. But yeah, the most important thing I think from my children's shifts that I've been doing, Thursday, it was kind of like a slower morning. I was there for, now that I'm done with nights, I'm doing like either morning or swing, and it was kind of a slower morning, like a lot of ortho things. And then like my last patient, I actually stayed there a little bit longer trying to like do a workout for this patient. It was like a 7-month-old that came in with like epistaxis and a little bit of hematemesis. It was probably the epistaxis, kind of like vomiting up the blood, fever, and trying to figure out like what's causing this, trying to get through the family history, getting a lot of history from the parents, and there was like a NICU stay that was like uneventful, and questions about the metabolic screen that turned out to be negative, or at least when I left it was. And it might have been the first presentation, basically, all said and done, of like a cancer for the 7-month-old. And we get patients that have cancer at Children's, but having it as the first presentation, most likely, and me being a part of it, was very like amazing, and it was a lot of learning for me, and it was just like, wow, there's so much that went into it. Chest x-ray, really what like we did these like ED chem panel, CBC, CMP, and like the numbers for like the liver, like very high bilirubin. Alk Phos was like 2500, PTT was like 110, and it just didn't like make sense for those like 7-month-old, and we're like, is there other ingestion type stuff? But it was just like Enfamil, and like maybe like a supplement that was like cherry bark, some things like that I don't think necessarily would cause some of these things. And it's pretty amazing. And you're trying to be there. I was trying to update the parents as much as I could. Called the PCP on call, called hematology, got GI going, and it was like, I think this baby's like in liver failure, and we don't know. Like, got an ultrasound, and I was getting updates from the person I signed out to, and it didn't. They ended up admitting to like general medicine, and I don't think they're able to visualize like a gallbladder. So like, what's going on? It could have been like, and something with the X-ray with the chest kind of like made it seem like possible early cancer picture. So that's what it was like, wow. So it was a lot of learning. The other like side note too is I my fiance Misty's coming back soon, so I'm excited. She's been able to have time with Papa and her family and everyone. That's great. I'm looking forward for her to come. I've been getting like this random call. Sometimes I get, we get random calls from fake calls and prank calls and like telemarketers. And this lady was calling me the last few times, and I answered it, and some lady from Indiana, I was like asking for someone that's not at this number. It's like, this is Mitchell, it's like not who you're asking for. And she keeps calling every so often, like every other day. And I tried blocking it, and now I'm starting to think that next time she calls, I'm going to answer, because she keeps leaving voicemails for a certain person, and either she has a number wrong or she's dialing it wrong. Or I was like, as a doctor in me, I'm like, this lady might have dementia. And the last voicemail was on Friday, and I was like, I already told her that this is not the person, so it could be that she's having trouble with technology, but then the PCP in me is like, could this lady have a dementia and like dialing my number and think it's to someone else? So that was kind of interesting. So next time I'm gonna try to answer it and like see if like this person needs help. But yeah, clinic on Friday was good. It wasn't too busy. Got to do some OMM, a lot of OMM. Really funny patient about BPH, I remember. And then like next patient I had, it was like had like a BKA on the right leg, and then on the left leg, and above knee amputation on the right, had a below elbow on the right. Only basically had one left upper extremity. It was basically from these like bus accidents from when I was getting from the patient, I think, blind in one eye. So it was just like a very tough situation. I felt for this patient that was, and really the patient came in because they had sore, like the one upper extremity that they're able to use for like everything in their life was like very sore shoulder, because they had a dental procedure, and like with transferring the patient, he got some pain. So I got to do some OMM. I got to adapt my OMM skills with this patient, and but with all that, he was still very pleasant, and I just felt this feeling that he was just like, this is my life. And he's been in this kind of situation for like 20 years, and I was just thinking, how does he get around? How is he able to do a lot of things? And gonna try to get him some more resources if I can. I think my colleague's kind of taken over as PCP, but I guess if I'm more of the pain management and like using my own MEM skills, which have been starting to really get used, which I'm very happy with. I have an elective coming up, treated another colleague, and that's what I'm trying to do. I'm trying to put it out there as much as I can, but I'm letting things come because I know they will, and I just try to do the right thing and try to make sure these skills are sharp for me, and my diagnostic and treatment skills. But yeah, so I've been able to come visit family. I had today off up north, and we got to go to Everett Marina and spend some time together. It's great. And work a few more shifts, and then I'll be switching to gynecology next week, which I'm excited for, since I don't get a lot of women's health as a male provider. And that's just, it is what it is, and hopefully we're missing some of the components, but I might be able to replace it with some like good ultrasound, and we'll kind of see how that goes. I'm excited for that. But yeah, I think everything's been good, just trying to stay positive, and a lot of good things happening. And I think I've been like finding the balance. It's like I got to find balance, and I got to be respectful to myself of when I need time, and for myself. So I'm trying to get that too. House sitting for another colleague, which is kind of cool. So I have like my studio still, and have another place to kind of check out and help out, and it's nice, big change for like a bigger place from where I'm used to. So it's nice to be able to do. And then recently got featured as an alumni spotlight from my college, undergrad, Eastern Oregon University, and that was like the perfect timing. I really wanted that, needed that, and they spotlighted me on like where my process and where I am at now, and I was very thankful to have that. So yeah, staying thankful, keep working hard, and just finding balance. And I think that was like the thing I talked about when I graduated high school. When I gave a speech, I was talking about balance. That was like my key thing. Yeah, I remember that. It's kind of cool to remember now. But yeah, very thankful with my family, keeping it indigenous, and it's really nice. And just feeling solid about that. And, it's like I don't, grew up not knowing my identity really well, but it's like, this is me, this is us, and like I don't have to prove nothing. Just me living and being where I'm from is like, that's native, and it's real. And it's nice to see that come together and reveal itself. Very thankful. But I gotta keep doing my part and more, as much as I can. But yeah, celebrating some birthdays too. So there's a lot of birthdays in July for my family and a lot of families, friends. I think that's everything I want to talk about. Work tomorrow, swing. So I'll have to leave here, go to Children's, and then I have a couple day shifts, and I switch over clinic Wednesday, and then Guide, so I have like Planned Parenthood or clinic. Then I'll be on outpatient, so I'll be like on the on-call shifts, like at risk, backup, day float. So that'll be interesting to, if I get called in and fill that role. So, all right, keeping mission minded, keeping indigenous minded.